Good evening, everyone. My name is Michael Tozzoli. I'm the CEO at West Bergen Mental Healthcare. Thank you so much for joining us tonight. A strange environment for all of us. We would typically be at a really nice auditorium. I actually think we were originally planned to be in one of the nice rooms at the Ridgewood Library, but here we are in this sort of cyber world where I'm in this room alone, and the Valley staff is 2 rooms away doing just their wonderful job. And so we're going to do our best to present the material in as warm and engaged a way as we can, given the COVID world. So thank you for joining us. I really appreciate it. Just a brief word. Slide to move, hold on a second. Okay. Brief word about West Bergen Mental Healthcare. West Bergen, located, actually headquartered in Ridgewood. We quietly treat thousands of people in our community. West Bergen, like Valley, is one of those staples of the community. We are the quiet folks that quietly take care of dozens and dozens of people, actually thousands of people over the course of a year. We do all kinds of programs from children and families and adults. You name it, we do it at West Bergen. I don't think most people know that we're there, to be honest, and as CEO, it's not such a good thing. I would rather everyone know that we're there. We've been there since 1963 with 2 offices on Chestnut Street. We have a large children's center in Ramsey and all kinds of group homes and residential services throughout the county. We are a large employer with almost 300 staff, and we do lots of wonderful things in the community with amazing clinicians. I myself am a clinician, so although I am the CEO at West Bergen and have ultimate responsibility for the strategy of the organization and the direction, I'm a clinician. And so tonight, as we are going to jump into a really difficult topic, I am here as the clinician, Michael, not the CEO, Michael. So know that West Bergen is here for you if you need us. Just a brief word in terms of the COVID. We even have a hotline for those that need to talk to anyone about the issues that have gone on, 201-688-7098. So here we are tonight, a really difficult topic, and I'm so excited that so many people are logging on. I have to tell you, I was a little wondering, given the COVID and being online, whether folks would really dive into such a heavy topic on a Thursday evening. I'm really glad you're here. This is going to be a difficult conversation, but I hope that by the end of this evening, and we plan to spend about 40 minutes talking to each other, we'll also take some questions, as you know. We're going to be talking about what suicide is, some of the statistics around it and how important it is for us to be here tonight. We're also going to be talking about what you can do if you know someone, talk to someone, run into someone, or have someone even in your family that you're worried about with suicide. I'm going to give you some very concrete tips on how to handle that and some suggestions on how you might go about that. As we settle in for the evening, think about, as we begin, what your own thoughts and feelings are about this topic. It's a heavy one, and so whether you've been impacted on it by yourself, whether you have been impacted on it in your family or in your community, it really is a difficult one to wrap our thoughts around. And yet the stats show us that it's a really critical one, and one that continues to grow, sadly. Do you know someone that's been affected? Do you know someone that you've lost to suicide? If you do, my deepest and profound condolences to you on behalf of not only myself, but every clinician practicing out there. That's a moment of pause and a moment of profound sadness when it happens in our clinical community. I know that it's that way as well in the wider community. We are, though, glad to be here. We're happy about our partnership with Valley Hospital and think that in many ways, it's the organizations like Valley Hospital and West Bergen Mental Healthcare that are going to organizationally be responsible for doing something about suicide. There's sort of the micro component of the clinician in the office this afternoon at 4 o'clock, but then there's the macro process of what are we doing as a community, what are we doing as a bigger group to do to lessen suicide and to have it be reeled in. That's where you need to put some pressure on Valley Hospital and West Bergen Mental Healthcare. It's where I need to feel some pressure as it relates to this topic. It's really an important one, and it's one that I personally do a lot of talks on. I have a lot of clinical research and background on it, and so I'm looking forward to sharing that with you tonight. Why should we talk about this topic? Really, why are we here? I have to tell you, discussing it does help. It really does. talking about most things in life, actually, clinically, talking about difficult things really do help it sort of take the wind out of the sails. Admittedly, this is a tough one, but I have to tell you, if we together can come to a point where we have a common language, where we have a common comfort, not only in having difficult conversations, but in having specific conversations about this topic, it will help. You will help your friend, you will help your relative, you will help the community overall. One thing that I really want to start out with from the beginning, I'm going to start with this and I'm going to end with this. And if there's one thing that you take away from this evening's talk, one thing only, you don't need to remember who we are. You don't need to remember any of the statistics that we're going to quickly go through. What I want you to remember as the one takeaway is that discussing it, asking someone about it, are you concerned? Are you thinking about hurting yourself? Does not plant a seed. There's a very common myth out there that I'm afraid to ask my family member or my friend, are you thinking of hurting yourself? Because I'm concerned about planting a seed. The research shows us over and over and over again that that is simply not the case. It is, in fact, the opposite, and we'll get into that in a little bit this evening. How can we each make a difference? It's really why we're here tonight. So I thank you for being with us, and I thank you for just being here. That alone is making a huge difference in this entire topic. So I'm going to suggest to you tonight that suicidality, is a mental health issue, indeed, but I'm going to push and suggest that it is a public health issue. It is such a big issue. The numbers and the statistics are so scary that it's gone from as kind of a small, shadowy topic of research and a small, shadowy topic of clinical focus to a big topic. I think that we should be using a public health model. I think that we should be looking at this from a macro point of view, and we're going to discuss that a little bit tonight. You being here tonight is part of that process. Think about it from a public health point of view. So let's look at a few of these statistics. Suicide, the 10th leading overall cause of death in the United States. Not the 50th, not the 80th, not the 90th, 10th. It's in the top 10. For individuals, and hear this age, 12 to 34, it is the second leading cause of death. That is incredibly sad to me, particularly when you think about 12-year-olds and 13-year-olds. Very, very difficult to wrap my own thoughts around that. I'm not sure how you're feeling, but I still struggle with these stats. For those individuals that are ages 35 to 54, it's the fourth leading cause of death. Get these numbers, second leading cause, fourth leading cause. This is not a small issue. This is a big one, and I think it's why you're with us tonight. It's why Valley Hospital and West Bergen have partnered together to try to focus on this. Every day, and that means today, Thursday, 132 Americans die by suicide. Every single day. Divide that by 24 hours, and we are going to lose people during the period of time that we are together this night. And so that's challenging. That's upsetting. It's sad. But I want you to know that we can do something about that, and we will. The concerning part for me as a clinician, concerning part for me as the CEO of a nonprofit that oversees mental health, is that the statistics have grown every year for the past 15 years. It's a scary number to me. It's going in the wrong direction. And so I've taken on as a personal mission, both as a clinician and as a human being, but also as the CEO of West Bergen Mental Healthcare. We need to do something about this, and we need to do it now. In 2018, the last dates for which there were full statistics, there were 1,400,000 suicide attempts. Remembering that we focus a lot on death by suicide, and we certainly should, but the big area to focus on as well are the attempts. These are the numbers that are not necessarily easily extrapolated from the data because folks often have that. It happens quietly. They're treated. They continue in their treatment, and it's not really reported in a public health kind of way. The latest numbers that we're aware of that are accurate, by the way, are about 1.4 million attempts. Interestingly, men die by suicide 3.56 times more often than women. They tend to be more successful. They don't tend to have higher suicide attempt rates. They tend to be more successful, frankly. And so when they do do a suicide attempt, they tend to die by suicide in a more common way than women. White males account for 69% of completed suicides, and firearms account for 50.5%. About half of every suicide that happens is as a result of a firearm. I'm not interested at all in the public policy around gun control or any of that. It's not what that's about. It's really just understanding that that is a factor, that is a fact. And so we need to think about that both from a societal point of view and a macro point of view. We need to think about that from just in our own homes. So here's the thing to think about there. If you have a firearm in your home, you have a firearm, you have one in your home, ensure you keep it closely and carefully locked away. Know that if you have someone that is even close to suicide, if you have someone that is struggling with mental illness, you need to take special care to put that firearm away. I personally would remove it from the house. That would just be me. But it's just, a different decision for everyone. But know that it does account for 50% of deaths. The impact on the families and others is beyond what I can describe to you. I personally have treated many, many families, and at West Bergen, we treat devastated families who've lost an individual to suicide. This is not just a family issue, that it's such a huge issue that when the death occurs, certainly the family is devastated and have difficulty wrapping their thoughts around it. Their life is forever changed. We can absolutely put them back together. We can rebuild their lives. We can teach them how to live a life and keep going forward. It will be, however, forever different. Know that the impact on friends, the impact on the community, think about the buzz that you hear in our local little communities, Ridgewood, Mawa, Midland Park, when a suicide occurs. Really challenging. It really has an impact on folks overall. More families have been impacted than you think. I have to share with you that I was proudly posting that I was going to be here tonight, and certainly Valley Hospital posted that I was going to be here tonight through their social media. I have a large social media presence personally, a couple thousand people on Facebook and a couple thousand people on LinkedIn and some of the others. And some of them are distant relatives, as we all must have in the social media days these world. And I got a private messenger on Facebook that really surprised me. And it was a result of this talk. And let me quote it for you. I see you were doing a talk about suicide on October 8th. Are you aware that your, adding the word parentheses, third cousin, and then she put in his name, I am not going to for the purpose of this talk, took his life last year? I was not aware of this. I certainly was aware that we had a distant cousin who was struggling with mental health issues. I was aware that there were issues that had gone on. I was not aware that he had died, and I certainly was not aware that he had died by suicide. So I can tell you it's a funny feeling. I was really taken aback by that, taken aback by sort of how it happened with the presentation tonight, and taken aback about trying to wrap my thoughts around that. Of course, I really centered in on the person that messaged me, who was a closer relative to him, and provided support and thoughts and empathy to them as we went forward. Know that it is possible for family and friends and loved ones to recover. There is sadly, a large community out there of survivors of suicide. There's large groups, support groups, clinicians, advocates, tremendous number of people out there that are in some ways, the sad, silent, quiet army that really deals with suicide out there. There are some communities that are impacted at higher rates. These are communities from a public health perspective that we need to think of in a slightly different way, just because the numbers are staggeringly higher than typical population. And I'm just going to call out a few for us to be sensitive to and be empathetic about, and for us to actually wrap our research around, and for us to wrap our programs around. LGBTQ+ is a community that has a higher percentage of suicide. I can tell you that in the trans community in particular, they have a very significantly high, up to a third of individuals that are trans will have attempted suicide at some point in their life. We're working with those communities very closely. We try very hard to reach out to those communities and build programs around them. But that's a community that we need to be careful about and be knowledgeable about. The other difference in the LGBTQ+ community is that the suicidality tends to be younger. So it tends to skew a bit younger into the teens and even a bit younger. And so that's something that we need to just be mindful of. It's something that we each need to be mindful of in our worlds. Seniors are constantly struggling. We know that it's not easy getting older. We know that that is a challenge. But we know that particularly when a senior is a caregiver, especially if someone that has significant health issues, dementia, COPD, significant physicality to to the caretaking. Suicide is a much higher rate than it would be in the normal, quote unquote, normal population. So again, as we think about our families and we think about the family support that we build around the community and around each other, we need to think about these communities in a different way so that the more social support they have, the lower the rates of suicide will be. White men account for the highest degree of completed suicides. White men in particular, between the ages of 40 and 59, are the quickest growing death by suicide segment. I'm really pleased to say that at West Bergen, since COVID happened, we have really revolutionized how we do our work. We, like everyone else, like Valley Hospital and like each one of your businesses, we had to completely pivot how we do our work. So now most clinicians at West Bergen are doing all their work via teletherapy. It looks a lot like I look right now. And you are home, and I am the clinician in the office, and we are doing our work together. White men have always been fairly low. White adult men have been always fairly low on the number of clients that come into West Bergen. And at West Bergen, we treat thousands of clients over the course of a year. So it's enough of a number that statistics do mean something. We've noticed that since we've been in teletherapy, the percentage of new calls, so meaning new treatment seeks coming in, of white men is up significantly. We're not sure why that is exactly. We have some theories. Some theory is that there's a little bit less stigma associated with not coming to a mental health center. You're able to log on, maybe even while you're at work or while you're in your basement while your family's home, and do your therapy. For whatever reason, white men are reaching out adults at a higher rate than we've seen in the past. We are happy about that, given this statistic, because that's a community that we, frankly, in the mental health community, have had a really hard time accessing and a really hard time educating and a really hard time treating. And so I'm happy to see that in the West Bergen statistics, because this is a concerning stat. Veterans, of course, higher rates of suicide, particularly those veterans that suffer with post-traumatic stress disorder. That's a significant disorder that really occurs over time. Those folks with PTSD do have higher rates of suicidality, particularly fantasy about suicidality. COVID, mentioned earlier, has had a big impact in the mental health community. It's actually had a big impact on the suicide community as well. Look at this stat. Kaiser Family Foundation, major research entity in terms of public health around mental health, says now a majority of Americans believes for the first time that the pandemic is taking a toll on mental health. A majority. Up to that point, less than a third of the United States believed that mental health was a big issue. Now it's completely flipped. Look at this next stat. Very concerning to me. If any of the stats are most concerning, this is the one that concerns me the most. CDC, coming straight out. 11% of Americans considered suicide in the month of June. That's double 1 year ago. And anytime you see anything that doubles in a statistical anomaly, it's concerning to us from a public health point of view. It's something that we really need to do something about and need to build more systems around. That's why we're here tonight. It's why you're here tonight. And so I thank you for that again. Last one. 1 in 3 adults reported symptoms of anxiety or depression since COVID has begun. This is up from 1 in 12 at this time last year. So 1 in 3 are reporting symptoms of anxiety or depression. So do me a favor now, take a breath and think about 1 in 3. How many people live in your house? You live with 5 people, 4 people? Remember, 1 in 3 are suffering with symptoms of anxiety or depression. Tomorrow morning when you head out to the store or you go to work, go down your street and count the number of neighbors that you know. Think about 1 in 3 of them reporting suffering with anxiety or depression. Public health issue, it's a big one, and it's one that we need to wrap our thoughts around. We in the mental health community actually think of ourselves as the 2nd or 3rd or 4th wave, however you want to put it, of COVID. The mental health community is really on guard. Demand is up at rates that I cannot even possibly describe to you at West Bergen, not just at West Bergen, but at all the other amazing mental health providers that are out there, including private practitioners and clinicians. Demand is up, and the system is simply not big enough to manage the demand as COVID continues. I do think that's increasing a bit now that we're going into the fall. Summer, there was some sense of relief, there was some sense of being outside, some sense of connectivity. Folks haven't quite figured out how they're going to do that as we go into October and November and December and on into the winter. So I do think that there's some increase because of that. And we will figure it out. But know that that's just a really concerning statistic. Let's now talk for a few minutes, if we can, what you can do if you someone that's thinking about suicide. So statistically speaking, we just covered all the stats. Here's another stat that's not even a specific number, but it's a fact. At some point, you will come in contact with someone that is contemplating suicide. So that may be a family member, it may be a friend, it may be over a cup of coffee or a beer, it may be at the racquetball club or at the gym that you're talking. You are going to eventually, if you listen well enough, you are going to eventually run into someone that says something that's concerning to you. And we want to make sure that we give you some very concrete things that you can do to arm yourself and really feel prepared for that conversation. Know that when it comes to teens and young adults, we need to start to have conversations with our teen and young adults, because our concern and frankly the facts are that they are texting and messaging each other through all kinds of mediums that change every day. But know that at some point your teenager is going to get a text, likely to be in the middle of the night, from a friend who says something that's concerning. And so it's upon us, the adult community, to really teach our kids, to bring them along, to give them the skill set to deal with that, because it will eventually happen. I do a lot of talks out in the community and did a number last year at various schools around the community, all kinds of ages. I did one at a local private school, and closed door session. I asked if anyone had had a friend that had suggested that they're going to hurt themselves via text in the middle of the night. The room was really quiet, and slowly one after another of these young teenagers began to report that yes, particularly when it comes to texting, when there's less intensity, and we're able to share with each other without embarrassment or shame, there have been some really challenging conversations. It's an important skill set that we need to teach our teens on how to deal with it. Really, at the end of the day, the question is, really, are you ready for it? Are we ready for it? Are our teens ready for it? So what can you do when someone says something concerning? First, let them know you're listening. Couple phrases, and I try to always give phrases because this helps people to wrap their thoughts around what I'm saying. Sometimes, especially in our field of psychology, we can be a little abstract when we talk. And so I try to use quotes and try to use specific statements so that you can steal them, use them, more importantly, make them your own in various thoughts around. So use a couple of these. Thank you for sharing this, and thank you for trusting me when your friend shares with you that she is thinking about hurting herself. Open-ended, that must be really hard for you. And the trick on that question is to say that and then to zip and listen. That's a really hard one because often we need to be in control of our own feelings. It's startling to have someone share this information with you. And so the more centered you are and the more equipped we hope you will be by the end of this evening, the better things will be. But know that that open-ended statement, this must be really hard for you, often cracks the egg and opens that dialogue and that conversation. Show your support, your unyielding support. In your own way, make sure they know that you're there for you. Nothing will change between us because of how you feel. I have to tell you that most people that are suffering from suicidality, from suicidal ideation, and from those thoughts about death and dying and suicide are incredibly ashamed of it. There's the fog not only typically of depression, but there's the fog of the shame of feeling suicidal. And so that consistent, ongoing, and clear message that you're giving them, nothing you share tonight with me tonight is going to change how I feel about you. We'll lift that fog a little bit of shame, hopefully allow them to verbalize what's going on, and for you, frankly, to help them move on with that. Encourage them to keep talking. Whatever you do, keep them talking. And so let them know you want to hear more, even if it's hard for you to hear. And so keep listening. And often you're hearing stories and tales of deep despair, sadness, darkness. It's hard to listen to. It really is. And I can understand the sort of balking and the shaking a bit. Hang in there. Stay with your friend and really continue to listen. Again, those open-ended questions. What is that like for you? That open-ended question that sort of dangles is something we train in our graduate school training about over and over and over again. And the open-ended questions allow people to go where they need to go after you ask the question and you're not then kind of controlling the direction. Ask them about their life. How long have you been feeling this way? Is there anything different for you? Is there a job situation that's gotten worse? Is there a relationship issue? Sometimes we have substance abuse and alcohol use. Sometimes that can be hard to listen to, but that's often part of the story. And sometimes those folks, frankly, are self-medicating. They're trying to figure out how to feel better, and they agree not in a healthy way, but they're struggling to feel better and struggling to do something about it. So really being aware of what's going on in your friend or family member's life, what has been different, what are the risk factors that we talked about earlier, that's where your antenna should be up a bit. Again, reiterating, and I know I said I was going to say it at the beginning and the end, and now I'm going to say it right in the middle. Asking someone about suicide or hurting themselves will not plant a seed. The research shows us over and over and over again that that simply is not the case. In fact, it's quite the opposite. So typically when someone is feeling suicidal, when they're feeling that dark and that in despair, if you are looking them in the eyes and you're sitting with them face to face and you are connecting with them, it usually, frankly, doesn't take much for them to break down. And I don't mean crying, but I mean open up in a way where they admit that they're feeling suicidal. Not unusual at all. Doesn't take much. It takes just a bit of active listening. It takes a bit of poking, asking the right questions, and just being open to listening to them. Ask the questions. Has it ever gotten so tough for you that you've thought about killing yourself? That is an okay question to ask. If they feel reassured, you hear this clear sense of reassurance. Never, I would never do that. You'll feel it in your stomach and in your mind, and you'll hear that difference, and that's great. But if they are, you're going to really get into that and really speak very honestly and openly with them. Throughout these conversations, you're going to need to work to manage your own feelings because they are going to be scary, upsetting, worrisome. Think about your role as a parent or sibling, or even a close friend. If you're sitting with someone that you care about and you love, and they're telling you that I'm in so much pain that I am thinking about hurting myself, you're going to have a strong reaction to that. And by the way, you should have a strong reaction to that. Our goal, though, when we're listening is to sort of center ourselves, to keep ourselves kind of in the neutral stance, trying not to sound judgmental, because I think sometimes family members and frankly clinicians get nervous and we sort of strike in like, whoa, you can't do that, or you shouldn't do that. And I get the feeling is honest and it's actually quite loving, but trying to be non-judgmental is really critical in this intersection. It actually will allow the conversation to continue. It will allow the person to continue to open up their feelings and open up their thoughts. Reassure them that there are many folks out there that care about them, even if they're alone in the world, and we all have folks that we know that are really alone in the world. If you in that moment, though, are the person that's standing with them, sitting with them, connecting with them, remind them that you are there. Remind them that you care about them, that you care about them deeply, and that you wouldn't want to see anything happen to them. Reassure them. Here's what I usually say when I talk in the community. There's lots going on in the mental health world. Depression is up, as you know, as we talked about, anxiety is up, suicidal ideation is up, those issues are real. There is good news. Here's the good news. The good news is that treatment really does work. The data shows us, the statistics show us that if we can get someone in for accurate, appropriate type of level of care and the appropriate level of care, they will feel better. So what I typically say to someone, and you can steal this, is, I get that you're feeling unbelievably lousy right now. I need you to hear my words, and even if you don't believe me, I'm going to ask you to file it in the back of your brain. Remember that I said that you do not need to feel this way, that we will get you to feel better. Treatment really does work. And so getting them to sometimes also use an analogy of a physical illness. If you had a fever of 103 week after week after week, of course we take you to the doctor and prescribe meds and do whatever we need to do. Know that sometimes people respond to those kind of analogies as well. Usually try to explain that, particularly with severe depression and anxiety, post-traumatic stress disorder, and some other, there is a brain illness going on. It's not unlike having the flu. It's not unlike having a virus. You have a brain illness that we need to treat. More importantly, you have a brain illness that we can treat effectively, and we will get you to feel better. Trust your instincts. I typically say this to everyone out in the community. We can teach you all kinds of skills, and you're certainly getting some tonight in terms of what to say, when, and how. At the end of the day, I need you to trust your instincts, particularly if you're a parent, particularly if you're a family member. Whenever I do a workup on or a diagnostic on a child or an adolescent, I always meet with the parents. And at the end of it, I'll typically say, what is your mom instinct telling you? What do you feel in your stomach? 99% of the time, that is accurate. And so don't overlook that at all. Often, the first call is the hardest thing for someone to make. So you offering to make that call or sit with them when they make the call, whatever that is, provide that level of support. Sometimes will make a big difference. And so sometimes that just means that you're going to be sitting next to them when they pick up the phone and call either the hotline or a clinician or an emergency room, whatever the situation is. Sometimes you don't need to do it, but you need to be sort of sitting there and just be present. Those moments of, if you're going to make an appointment with a therapist and you're afraid to go, fearful, concerned, I get that. Can I drive you to the therapist? I will sit in the waiting room. Of course, this was pre-COVID. I will sit in the waiting room and wait for you and be with you. Often that actually works. It's also a message of love. It's a message that you care. It's a message that you're not going anywhere, even under the most difficult of circumstances. Other quotes. I think it would be helpful for you to talk to someone. Often they have that instinct. Often someone that's suffering that poorly knows that. They just don't quite know how to pull it together. They don't quite know how to reach out to the mental health system. They don't quite know how to, they literally don't know what to do first. And so, but they typically do know how that could happen. How can I help you connect? Do you need a ride? Most importantly, we can figure this out. Note the word we, because often folks that are feeling suicidal are feeling incredibly alone. They are alone in their heads and they're alone in their hearts. And you have a moment of stepping into that. And you have a very special place in their life. And so take that responsibility, take that honor very much to heart. Acknowledge that they are at times not ready to reach out for treatment. So this goes for when you're with someone and you're asking them to reach out for help and they say, I'm just not ready to do that. Difficult call, right? I get that. Certainly acknowledging it, sharing resources. Ask if it will be okay for you to follow up the conversation. If you feel comfortable enough to leave that person alone, so they're not actively suicidal in the moment, it's really okay to say, I get that you're not ready for treatment. I get that you're not ready to reach out to talk to someone. Ask them bluntly though, would it be okay if I followed up with you and we discussed this again? I have to tell you that most times they're going to say yes, because think about how upsetting this is for us to hear. They're carrying around this heavy weight, typically for weeks to months, often years. One of the statistics that I dislike the most as a CEO of a mental health center is that the average amount of time it takes for someone to reach out for help from the time they have a diagnosable mental illness to the time they reach out is somewhere between 6 and 8 years, not weeks, not months, years. We all need to work together to get that number down, by the way. But know that what that tells us is that they've been carrying around this weight for a long time. And so going to them and saying, would it be okay if I reached out to you this evening? Can I give you a call after dinner and we can talk about this again? Essentially asking permission to go back to the conversation and revisit it. Constantly going for the I am here for you, regularly sending that message. Some folks, by the way, are more comfortable going to their primary care physician. That's why there's quite an initiative in the United States, actually in the suicide community, to train a little more effectively primary care physicians. They're well trained and they've begun to focus on mental health really in the last few years in a way that's amazing. It's wonderful. Know that often the very first place someone goes is their primary care physician. And so even if you can get them to go to their GP and make an appointment, do that, because that person will hopefully assess, that person will hopefully link them to someone in the community and someone that can touch base with them. The overwhelming majority of antidepressants in the United States are prescribed by primary care physicians, not by psychiatrists, by the way. So know that if there's an immediacy of an issue, again, we talked about that trusting your instinct, trusting your stomach. If there is an immediate instinct, you can't leave them alone, and you may need to reach out for a 911 or 262 HELP in Bergen County is the mobile emergency number that we would use. But really 911 is the quickest if you feel like the person is in immediate danger and your stomach is telling you that in this moment. Trust it. You won't be sorry in the long run, although they may be a little bit upset with you. Now that we've sort of explored what you can do as an individual sitting with your friend or your family member, we need to think about what we can all do as a community. So thinking about sort of the macro, continue to have the conversation, continue to push yourself to have these conversations in the community, continue to log on to Valley Hospital when they have these talks on mental health, and continue to open yourself up. It breaks down the stigma. It breaks down those barriers that are all in the way of people reaching out for help. Do anything you can to break those barriers down. Encourage the Valley Hospitals of the world and the West Bergen Mental Healthcare to continue to do these type of programs. Push our organizations harder to do more to get those statistics down. We have a responsibility, in my mind, an ethical responsibility, I would argue a moral responsibility as organizations to do more to prevent mental health from erupting. Honestly, small fires are so much easier to put out than big fires. It's not any different than preventative health. And so I think we've come a long way in the mental health community and knowing that and reflecting on that and being part of that. But we need to do better and we need to push ourselves more. And so I put myself squarely in the middle of that lane. We need to be pushed and to be pushed more. I always do in these talks, I always ask you if you have someone that you're concerned about, why'd you join tonight? Why'd you come? Is it someone that you're concerned about? Is it your brother-in-law, nephew? Is it your daughter? Maybe your mom? Maybe you use the opportunity of this talk to open up a dialogue. Essentially blame us. So tell folks that you came here tonight and you listened to a talk on suicide and you listened to a talk on mental health, essentially. Talk about it. Open up a dialogue. In that early part of the conversation, you're not talking about them. You're talking about us and talking about you and our communication together. Very often that will open up a communication line. Very often that will open up a level of dialogue that will come forward and open up the dialogue. That's the most important thing. So having said that, we need you to reach out to us. Questions, ideas, concerns, my email is there. Barbara Hand, who's on the West Bergen team, is available. Certainly Valley Hospital is available. We would want you to reach out to us with questions and concerns. All right, questions? Thank you. So thank you for writing in. Thank you for quite a few questions, actually. Thank you for that. I appreciate that. I'm going to read them now and go from there. So, what can a parent do to prevent this from happening to my child? Really good question. It's all about prevention. Again, I would suggest to you that you talk to your child tomorrow. Let's say it's a teenager. I would do this in the next few days. I would say that you visited Valley Hospital tonight, you sat through a talk, you go to a lot of these talks, and you heard a really interesting one on suicide. You heard a really interesting statistic on depression or anxiety. I would ask the question, how are you doing? How are you feeling? You know, listening to that talk the other night had me think about what that might be and had me think about how I can be helpful to you. You want to start to do that conversation now before the fire erupts. Another little tip, if it's a teenager, particularly a teenage boy, I'm a big fan of taking them for a ride in the car. Because sometimes looking face to face can be challenging and difficult. So sometimes that drive in the car, take the long way to the doctor's appointment, take the long way to grandma's house, do what you need to do to keep that car going. Because often teenagers will talk in the car in a more comfortable way. And as long as the dialogue is flowing and as long as it's moving, that's really what we're about. How does someone find a good therapist? Really good question. There are many, many therapists out in the community. There's certainly organizations like West Bergen and many others that are really well suited to meet your needs. There's lots of private practitioners. In all honesty, what I would do is start asking around if I was looking for a clinical referral. So I would ask your neighbor or your friend, or perhaps it's a clergy person in your life. Maybe it's your general practitioner, your GP. You want to start to ask questions. Do you know anyone that's good? Do you know anyone that you've had a really good experience with? You know, the wonderful thing about stigma is that it coming down has allowed us to compare notes in a much more honest way. And so a generation ago, one would never go to your neighbor and say, you know, I'm looking for a therapist for my son who's struggling a little bit with anxiety. Do you know anyone that's good? We wouldn't have done that a generation ago. So I'm really proud that the society has come a long way. Thank you. More questions coming in. And that those are opening themselves up to asking questions in an open and honest way. Ask. That's really the most important thing you can do. All right. Have you done talks for corporations? We have not done talks for corporations. We've discussed it, we've thought about it, and we should do talks for corporations. We've done all kinds of talks for religious organizations and schools and hospitals and community groups. Corporations are a really good idea and one that we should follow up on. I appreciate that very, very much. Hi, we are a survival family from suicide, and I would like to know how we can take programs like this to the Spanish community. Excellent question. Excellent question. I can tell you at West Bergen, we do have a number of bilingual therapists. I am personally not bilingual, although I did set that goal for me during COVID. I haven't done very well. But I do want to eventually speak Spanish and be bilingual. But we do have a number of therapists that are bilingual, and we probably could put a program together, one very similar to this, in Spanish. And I think that's an important one and a really important community. Any insight on why people so young, 12, 13, committing and attempting suicide? You're right, that statistic is scary, and that statistic continues to grow. In fact, the number gets lower. That early stat that we talked about is actually the lowest age reported in that statistics is 10. Why is that happening? It's a stressful world. It's certainly a stressful time. Kids have a lot more information coming at them. And listen, I'm a pro-technology guy. I love technology. I'm not anti-texting, anti-technology. I love it. I think it connects people. I think that COVID in many ways has sort of changed our relationship to technology. But having said that, it really allows a lot of information to be flowing into a young mind, a 10, 11, 12-year-old. Really difficult for them to process some things, really difficult for them to think it through. And so as they're communicating with each other at 10 o'clock at night, at 11 o'clock at night, at midnight, they're exchanging some adult ideas and adult concepts that are really hard for them to process. I also think, frankly, that our kids are a little more mature than we think. And I say that not in necessarily a great way. It seems to me that kids are becoming more mature younger. And so they're physically maturing in a younger way, so dealing with all kinds of feelings and thoughts that typically would have happened later are becoming less earlier and earlier. As such, as kids are acting more mature these days, they're more savvy about technology, they're more savvy about the world. We treat them as if they're a bit older than they are. And so sometimes we sort of forget that I'm dealing with an 11-year-old or a 12-year-old. That could be really hard, folks. A couple other questions. I'm a member of the Village of Ridgewood Stigma-Free Task Force. Go Stigma-Free Task Force there by every town. Thank you to the Ridgewood one, but thank you to every town in Bergen County who has a stigma-free task force. So very important. And a survivor of a loved one's suicide. Whenever I speak about it, someone almost always tells me they have been affected by suicide. Statistics do not lie. You're quite correct. Whenever we're out in the community talking about suicide and talking about some of these difficult concepts, we always have someone that comes up to us and says that they've had a family member or a friend or someone that has been impacted by suicide. The statistics don't lie. The numbers are up significantly, particularly in the last 15 years. And so why is that? Lots of theories, lots of sociological theories, lots of psychological theories, but there are reasons for it, but it continues to trigger up. As that triggers up, more and more people are dealing with it. As such, kids are much more likely to understand and hear about suicide in a way that they did not a generation ago. And although planting a seed about suicide doesn't really work that way, asking the question doesn't work that way, the concept being out there for a 9, 10, 11, 12-year-old really can be challenging, and it can be really hard on someone. What would you say to people who have lost good jobs, struggling with literally years now, not being able to get back to where they used to be in life financially? Financial stress is one of the biggest stressors that we're seeing now under COVID. It's actually pre-COVID, of course, but we're seeing lots of stress around financials. Unemployment rates are significant, and underemployment rates are significant. And so those folks that are well educated or maybe have a long history of a technical job that they did unbelievably well for 30 years and then were downsized or lost their jobs are now underemployed or operating in a job that is not at the same level that they were before. Financial stress is one of the hardest things for us to deal with. It's really hard, particularly in our area, of course, because we live in an incredibly expensive area. Anyone that's dialing in around the Valley Hospital catchment area of Bergen County, or indeed the whole tri-state area, knows that living around here is very, very expensive. Know that we have relationships with a number of the food pantries around, and they are really overwhelmed at this point. And I think that's just a reflection of economic insecurity, food insecurity. That's a big one. And so coming in and dealing with that therapeutically may be helpful, because attached to that, of course, are feelings of shame, embarrassment. Perhaps you feel like you're not living up to your best self. Maybe you're not taking care of your family in the way that you think you should be taking care of your family. And so what is a financial issue quickly can become an emotional and psychological issue, and one for us to really help you with. And by the way, we can help you with that. Another question. My husband is chronically depressed and attempted at 21. He's in his mid-40s now, but has always been resistant to treatment. Never really had it. Any outside-of-the-box ideas how to encourage treatment? Really good question. Some folks are afraid of treatment. Some folks are treatment resistant. Some folks just don't want to come in. My recommendation here, just something to think about for this particular family member, would be you. So you talked about it being your husband, and so I would wonder about you starting in your own therapy, because you need the support around having a chronically depressed husband, and understand the skill set and understand the process around that is only going to be helpful to you. Knowing that you have support is going to help. It's going to help him. I would wonder if you started with a therapist and then invited him into the process. So let's say 3 months into therapy, 4 months into therapy, you invite him to join you for a session with your therapist. It may break down that stigma, it may break down that barrier, that fear, sounds like to me, on the part of your husband that may be struggling with coming in for treatment. Seeing your therapist, though, and coming in and dealing with you may be a way to get him into the room, into the therapeutic room, and just have that experience. It's a tough one. Sometimes also with men, particularly he sounds like he's in his mid-40s, that can be a really challenging crew. Sometimes they'll open themselves up to a support group, particularly if there's a particular issue, substance abuse or alcohol, or underemployment. Sometimes a support group, not around themselves, because they feel like they're in a group setting, that may sometimes work. That's a tough one, though, and really can be really very challenging. So with that, I thank you for your questions. They were all really good ones. I most importantly thank you for being here tonight. Just being on this call, just logging into this process, just opening yourself up to this discussion will change a life. I promise you it will. And I would ask you in the next week, little assignment, in the next week, I'm going to ask you to go out there and have one conversation with one person about this talk. Just open yourself up to that discussion. Just open yourself up to what you think and how that can be. All right. So with that, I thank you very much for joining me tonight. Please do not hesitate to reach out to us at West Bergen Mental Healthcare. Do not hesitate to reach out to Valley Hospital. Know that we're working together and we are here to help you in any way, shape, or form that we can. So with that, I thank you very much for joining.